Hi guys, let's talk about under eye treatments. The under eye area is a really common place of concern for people, and that's for various reasons, but basically I think of it as it's the first sign of aging. The skin is very, very thin, and it's the focus that we have on our faces and on other people's faces. We look at people's eyes, so you notice things around the eyes. So things that can happen, first of all, the first signs of aging would be with some skin laxity, and that can show up as a bit of skin crepiness. What is skin crepiness? That's when you get little crinkles in the skin, maybe the makeup is settling in the crinkles and they're kind of over exaggerating that area. So in the 30s, in that 30s age group, when the aging process is not too advanced, injectable moisturizer can be really nice to help hydrate that area and to make that crepiness less noticeable. The next step, when the skin laxity becomes a little bit worse and it's more obvious, would be then to potentially start using energy-based devices such as heavy under eye Fraxel repair or Morpheus. Morpheus 8 is a really great skin tightening tool for that under eye area. So we've got the laxity or skin issue, then we go a bit deeper, and then what we start to find is that people will start to get hollowing around the eyes. Now, hollowing can be treated with dermal filler. However, we need to take into consideration the rest of the face. So if somebody's very flat in the cheek, we wouldn't want to start putting dermal filler into their eye, because that can make them have a swollen or a bulging out appearance when you look at them from a profile view. What we should be seeing is that the cheek has a higher curvature than what the under eye area has. So sometimes you might need to treat the mid cheek with dermal filler before you start treating the tear trough region. The other thing that's important to take into consideration when we're looking at tear troughs is if somebody has this, what I would describe as fat herniation. So if they've got a real big bulge in this area here, putting dermal filler into that area can actually accentuate that bulge and make people look more tired. So there needs to be, I guess, consideration from that point of view. And if somebody's got significant fat bulge as well as laxity, we can treat them with Morpheus 8. Of course, as things progress, as things worsen, surgical parameters can also be utilized. The other issue that people might experience is under eye swelling. So there is this little bag here which is called a festoon, and that can sometimes fill with fluid. As people age, the skin becomes more lax and it sort of doesn't hold that fluid bag back as well. And again, we would utilize things like energy-based devices to give you a skin tightening effect. So Morpheus 8 is really nice in that area. We have to be very careful with dermal fillers when people have got festoons or malar bags, because dermal fillers are hydrophilic, so they bring water in with them, which can be great when you're trying to hydrate tissue, but when you're prone to swelling, that can worsen the swelling. So that would be something that I'd talk to the patient about, and they wouldn't be a very good candidate for fillers in that circumstance. So that's a quick nutshell on under eye treatments. And yes, as you can see, it takes a different approach depending on the person.